Hey everyone, Johnny here with OhioCannabis.com. I'm in Akron today with Dr. Melanie Duhamel. How are you, Doctor?
I'm doing well.
Great to hear. Now, she's with OhioMarijuanaCard.com. They are this video sponsor. We've been partnered with them now for several months. They have 7 locations throughout Ohio and right now 11 doctors. They recently just opened up their Toledo office, which you are running right now, right?
Yeah, I'm getting it started at least. It's spreading between 2 offices, but we got to do what we got to do. We'll get everybody on board soon.
There's a lot of patients out there, and I know you guys have seen over 5,000 at this point as a company.
Yeah.
Tell us a little bit about you and your background. Where are you from? Because you're not originally an Ohio resident, right?
Exactly. I did my medical school and part of my training down in Florida, so that got me ready for general practice or general medicine. Having experience down there, knowing that medical marijuana is already legal, having a lot of colleagues go into it, it was kind of a natural segue into that. And through their experiences, their good experiences, the patient saved health. That kind of brought me around to this, moving to Ohio and finding it in a brand new state that was just getting started.
Yeah, it is really rolling pretty fast right now too, and I know you guys are trailblazing throughout Ohio. Tell us a little bit about the type of ailments that you've seen. Have you seen a particular ailment a lot, or have you seen all of them in general?
So, thankfully, I have seen at least one case of every qualifying condition. The most common is chronic pain, since that can take so many different forms and mean so many different things. But I've seen everything from cancer patients, seizure disorders. I've had some parents bring their children in, so very big variety.
Now, a lot of people, especially patients with or people with children, they're probably nervous about the process. How does it work? They're going to start off on the website and then come into the office and fill out some paperwork?
Exactly. So they can either fill out that paperwork, or at least the initial intake, on the website and be ready to go for their appointment. The other thing that is important is medical records to show kind of their history. Obviously, we haven't known these patients for years. We don't know their full story. Getting info from other doctors helps us fill out their clinical picture. From then on, we can kind of use the diagnosis information to determine how marijuana fits into that and how that would fit into their therapy. So they would come in, hopefully have their paperwork ready. If not, we do have staff that is specially trained to help contact other doctors' offices, make sure everything runs smoothly, get the information that we need. Then you would come back, chat with me. I'll do a quick physical exam, nothing painful, I promise, and go over history, kind of what brought the patient to considering medical marijuana. Usually it's not the first choice for a lot of people. Usually they've exhausted a lot of other options by this point. Then we talk about what forms may be good, what methods of administration. We start to get into a little bit about specific strains, although the jury's still out on exactly what dispensaries are going to carry.
Yeah, that's a hard one right now.
Exactly. So a little bit of basic background info, that way the patient at least knows what to look for going in and going forward. Then we spend about maybe 5-10 minutes doing a quick exit process with our office manager, just going over the info, making sure we give the patient frequently asked questions, paperwork, and information on where dispensaries are going to be, at least the ones that are announced so far.
Okay. And that's the big question, is where are the dispensaries and who's going to be open first. We're going to make sure we get that info out to you guys, and you know exactly where, what location does have medicine. Now, as far as the process here, once they go through the exit strategy, it's going to be a yearly registration with you guys, right?
Yeah, exactly. So right now we have an in-person yearly follow-up appointment. I definitely want to follow up on any medical conditions, if there's been any changes or new medical conditions, new medications, and then seeing how the medical marijuana is working, if there's anything we can help with, if there are new questions or new forms that have come out, kind of give an update, make sure everything is still working for the patient, that there's still a good option for them, and then that's pretty much it.
Okay, good. Now, what about CBD? Do you guys recommend that as part of the regimen?
Yeah, now that CBD is kind of rolled into the medical marijuana law, I find myself recommending it a lot. One of the blanket statements I will say is that I recommend that just about every medical marijuana patient have a bottle of pure CBD, just because it can have some good effects, or it can actually balance out some bad side effects that can happen. So without getting any formal recommendation, I definitely make use of it in the practice.
And I think what a lot of people need to realize with stuff like CBD is that you're not going to notice a difference. You might notice a difference right away, but you kind of need to keep a regimen up for a few weeks to get in your system and have a process for a little while.
Precisely. Some people feel it within minutes. Sometimes it takes a while to build up and people notice a gradual change over time. So every body is different. Every body processes medicine a little differently, and the regimen's going to be a little different for every person.
Okay. Now, as far as administration, you said you guys recommend what type of, whether it's a topical or vaporizer for patients. Our patients seem to be knowledgeable or educated on what's going to be available and what type of applications or process are going to be?
Yeah, a lot of patients coming in, especially since it's been so long in anticipation, have already done a lot of research. They've found things that they think may fit into their lifestyle or things that they at least want to know more about. And then that's where we kind of hash out the details of how to use different forms, whether different forms can be combined or overlapped, or what's the safest way to use it in combination with their current medications.
Oh, okay, that's really good. And so I got a couple more questions from some people. Now, will marijuana interfere with any other medications they may be on?
So it's always a possibility because everybody reacts differently to medicine. Some people can do well on some medications, whereas some can't even take it from the side effects. So there's that aspect to consider. The second thing to consider especially is blood thinners can always be problematic, and seizure medications, some of them can actually decrease in effectiveness when combined with marijuana, although seizures are a qualifying condition, which makes it complicated. Thankfully, the most common problematic medications have blood tests, so you can check your blood levels in concordance with your therapy, make sure the medicine is present in the right quantity for you.
That's good info. And start slow. There's no reason,
Always.
Especially if you're new, start slow. And things like edibles, you should really be cautious about, I think. Someone that's experienced with the industry, edibles are really a cause for concern because people can easily overdose on them. And I don't mean to say overdose is, you can actually die from it. You could just have some adverse effects from it.
Very, very bad time, exactly.
Yeah.
So there's no, again, deathly consequences to having too much of a dose, although it can be a very unpleasant experience.
Yeah.
Some people can have changes in heart and blood pressure, and if they already have problems with heart conditions or blood pressure issues, that can actually put them in the hospital in some instances. Personally, I've never seen it so far, but I never rule anything out. Overall, it's fairly safe, and yeah, going slow and building up your tolerance over time is the safest way to go about using the medicine.
Now, it's only a yearly visit to get the card, but are you guys going to follow up, or if patients want to follow up after a few months, is that possible?
Absolutely. Because we do a membership, I always encourage patients, they can call anytime. We have phone lines open. We have emails that we check throughout the day, and anytime a patient, if they want to walk in and happen to ask a question, or if they want to call in and make a follow-up appointment, I would love to see them. I'd rather answer questions and have everything out front than have people wondering or trying to figure out things on their own.
And that's important because we are trying to work within a regulated industry. We are trying to put out the best information and, guide people to the right products. And I think as a whole, Ohioans, the people that have licenses are trying to do the same.
Precisely.
Now, just a couple more questions here. They have to have a prior condition. You guys aren't diagnosing new conditions.
Correct.
They have to have documentation.
Exactly, and that's part of how medical marijuana came into legislation as an alternative. A lot of people who haven't done well with the traditional treatments or the traditional medications, or have used them and have not gotten enough benefit. So that's where the qualifying condition and the pre-medical records and history comes into play.
Okay, yeah, that makes sense. And I could say, be transparent with your doctor. Don't be scared or ashamed to ask questions, and really find out how this is going to work for you because, people are new. A lot of people are really new to this, and they don't know how it's going to affect them.
Exactly, and I say the same thing to my patients, whether that's transparent with me when we're sitting down. Everything we always talk about is confidential, so there's never any worries there. But even with their traditional primary care specialist doctors, it's important to let them know that they're considering medical marijuana or that they're using medical marijuana with the hopes that doctors will begin to see it as another medication that needs to be considered in treatment instead of necessarily something that's taboo or bad to use. Since now it is legal, it's medically recognized. It just makes sense. So hopefully we can help break down those barriers.
Yeah, that's a really good point. Now, there's currently 21 conditions. They've opened up input from doctors and from patients. Is there anything specific or a couple that you'd like to see added to the registry?
Yeah, there's actually a lot of things that I would like to see, which granted I don't make the rules, but I can do the best I can to advocate. Because although the conditions are fairly comprehensive in this state compared with other states as well, there are a lot of mental health conditions that would benefit from medical marijuana, or actually some who have been self-medicating for years, and now we're finding that there's a reason patients gravitate to that. So especially with anxiety, that kind of thing, but we'll see how the state goes, and obviously anything they suggest that I feel is appropriate, I will voice my opinion in recommending.
It's great to hear. Well, Doctor, we really appreciate you having us out here. Once again, this video was sponsored by OhioMarijuanaCard.com. You can go to one of their 7 locations, one of which is the newest Toledo office. So thanks again for having us out, Doctor.
Happy to help. Thanks for coming in.
Thanks. See you guys.
Sweet dreams are made of this.